The primary purpose of this procedure is to provide an easy and rapid route for medication and fluid administration in non-critical situations when IV access is difficult, delayed, or unnecessary.
This method can solve a large problem in the emergency department by facilitating immediate treatment protocols and palliation of symptoms in non-critical situations when IV access is difficult or delayed.
The main advantage of this technique is to be able to provide quick and effective delivery for medication and fluids, decreasing IV sticks and length of stay.
This technique is beneficial for retention enema administration, such as lactulose, K-exhalate, and treatment for constipation. The balloon makes it easier and more comfortable to retain the enema.
Being a painless alternative to intravenous delivery, it could be of great benefits in the pediatric setting, both for fluid and medication delivery, as well as for treating pediatric constipation.
First, assess the rectum for stool using a standard digital exam. It is best if the rectum is empty. However, formed stool is not a contraindication for use.
Prior to insertion, assess the rectal opening for contraindications, which include lesions, tumors, abscesses, rectal bleeding, diarrhea, or bowel surgery within the last 6 weeks.
If the device can be used, then first lubricate the catheter from the tip to the blue marker line with a water-soluble lubricant. Then, insert the catheter into the rectum to the blue marker line between the two blue arrows. Next, inflate the balloon using a Luer syringe by injecting 15 milliliters of water.